glad to meet somebody who is from all the way from Sao Paulo, bringing her medical expertise to the state of Louisiana and dealing, working with patients who are in the senior care. So, what brought you to medicine, and what's been your experience so far?
So I enjoy science in general, and that was, when I was choosing a career to follow, that was the my first motivation. But I'm very curious, and I like to help. So I think in medicine, I found the perfect career to help as many patients as possible, while also keeping myself curious and learning, and those being able to study and help patients. I think that was my main motivation to choose. I first did internal medicine back in Brazil, and then I switched to family medicine because I like seeing patients from all ages, from all walks of life, and I think family medicine and primary care really offer me this opportunity.
Awesome. Thank you. Thank you. And what are some of the biggest
Mhm.
challenges you see in working with your patient and providing services, or what challenges your patients face?
I think, especially patients that have chronic conditions, they have limited health literacy, and especially vulnerable patient populations such as elderly, poor income families, and being able to educate them beyond pills,
Mhm.
and lifestyle changes. I think that's where primary care have the potential to change their lives and health. But I would say limited health literacy, that's the main challenge we face, at least where our practice here in Louisiana.
Awesome. And what do you how do you address those no challenge literacy? How do you
It,
educate them?
yeah, it is hard. It's not one size fits all, because we live in a fast-paced society. So patients, they think they would like a magic pill that could solve
Mm.
everything. So first, I try to educate them that their lifestyle, their habits play a great role, and it's not a pill and a medicine will not do everything for them. So that takes time. That takes a lot of conversation, trying to know them better, try to understand their day-to-day lives, and that's when primary care makes such a difference, because you have to teach them about diet, physical activity, and habits, like if they drink alcohol, if they smoke, and things like that. And you get to know patients. You have to. Each patient is different, and
Right.
it's really subjective.
Good, good. Thank you. And we come across that very often. I mean, nowadays you can't escape AI, whether you're searching for something or shopping for something. Have you thought about, or have you seen anything that you thought, or any problem that you thought AI could solve for you or for your patients?
Yeah, yes, sir. So AI has been, in that sense, it's really interesting because they can also understand all this. AI can understand the subjective of different patients. So, for example, tailor recommendations on the basis of their health conditions and their weight, their um, past medical history, their medicines, and their level of physical activity. So in that sense, I think AI helps the physician um, kind of organize better patients that have so many complexities.
Mhm.
And I've noticed in my practice that AI helps us. It's like a aid. I wouldn't say we'll do our job, but it's
Okay.
definitely our great friend, I would say.
Well, augmented capability. Awesome, awesome. And if you were to use AI, or if you were to say, okay, these are the capabilities I would like to have for my practice, what would be one or two of them?
So being able to have, because I have a lot of patients that have different apps
Okay.
for different things. For example, blood pressure tracker. for their blood pressure, and then they have Dexcom for their diabetes.
Mm.
So it would be great to have all that connected to in the same app, connected to the EHR, and being something that could instantly, the physician could see, and even create reports like in the past 1 week your blood sugar was higher, or give notifications to both the provider and the patient. I think that would motivate patients to be more engaged with their health, and also help physicians act timely when we would notice changes sooner than later.
Awesome. Thank you, doctor. That was very insightful. Appreciate you sharing your thoughts. Thank you so much.
Thank you. It was my